Welcome all. In this session, we are going to look at epithelia. And by the end of this session, you should state the characteristic of epithelia, the classification of epithelia, the types of epithelia, and know the location of each and every type of epithelia, which I will discuss. Welcome all. My name is Maurice Munyeri, and I'm the redactor. Epithelia. What is epithelia? Epithelia refers to one or more layers of cells that cover the outer surface of the body or line the luminous surface of tubular structures and cavities of the body. Now, what are the characteristic features of epithelial tissue? One, they are highly cellular with little intercellular space. So there is close apposition of cells. They are usually avascular. You will not see blood vessels in the epithelia. Also, the epithelial cells, they rest on a basement membrane. You'll find some text saying the epithelial cells rest on a basal lamina. In fact, that is more correct because basal lamina is in fact part of the basement membrane on which the epithelial cells rest on. They also show polarity in that they have a luminal end and the basal end. They have a free surface and a basal surface. So the free surface is the one which faces the lumen, and the basal surface is the one which faces the basement membrane or the basal lamina. The epithelial cells may also display some surface modifications, such as they may have cilia, some have stereocilia, others are keratinized. We will be looking into that shortly. Now, classification of epithelia. The epithelium may consist of one layer of cells. So we might have one layer of cells lying on a basement membrane. That is simple epithelium. We might also have several layers of cells lying on a basement membrane. That is stratified. Also, we might have another one known as pseudostratified. If you look at it, some cells only all cells lie on the basement membrane, but some cells are short, others are taller. So some cells will reach the luminal side, others won't. So that is pseudo-stratified. Now let's start with the simple epithelium. Simple epithelium refers to a single layer of cells resting on a basement membrane or the basal lamina. Now it may be further classified according to the shape. So you might use the shape of cells constituting these cells. So when the cells are flattened, their height being a little as compared to their width, those cells look like they are flat. Such cells are called, such epithelium is called squamous epithelium. So maybe I do this first. So in squamous, you'll find those cells looking somewhat like this. They are somewhat flattened. You can find their nuclei here. So they are somewhat flattened, those cells. So they look like that. They are somewhat flattened. I hope you have an idea. Then others, when the height and the width of the cells of the epithelium are more, let me take back my pointer. Now, when the height and the width of the cells of the epithelium are more or less equal, i.e. they look like squares in cross-section, they are described as cuboidal epithelium. Now, cuboidal epithelium will look like this. The cells will look like that. They are somewhat square. Or you can use the shape of the cell, the nuclei. So the nuclei is somewhat rounded, have a rounded nucleus. So the nucleus is somewhat rounded. Okay. Then we have another one where the height of the cells of the epithelium is distinctively greater than their width. This is columnar. Now columnar will look like this. Columnar, they look like rectangular. Like that. The cells will be columnar. Sorry for that. There will be columnar. If you look at their nuclei, they'll be somewhat of elliptical. The nuclei will look somewhat like that. Okay, somewhat like that. So these you'll be using this. If they look like this is columnar, this is cuboidal, this is squamous. So please understand those, how they look. Okay, so let's proceed. Now, pseudostratified columnar, in true sense, this is a simple epithelium because each cells rest on the basement membrane. This epithelium gives an appearance of a multi-layered or a stratified epithelium because an equal height and shape of cells. So, okay, I don't know if I can draw that, but let's say here is the basement membrane. So you'll find some cells are very tall and they are reaching the lumen, but others, let's say, others will be shorter. So let's say, look like that. So here you will have these cells. This is another one here. You can see all of them are resting on the basement membrane. Okay. So one feature which I use to distinguish pseudostratified is that if you look at the apical side, this is the apical side, the luminous side, the apical side of these cells, it is at the apical side, it is devoid of nuclei. So at the apical side, it is rare for you to see nuclei here. So the nuclei will be mostly on the basal side. So maybe that is a tactic you can use. Then we have multi-layered or stratified epithelium, use stratified. So it consists of multiple layers with the basal layer resting on the basement membrane. The epithelium, note this is a very important point. This epithelium is named according to the shape of the cells at the most superficial layer. So if we have a basement membrane here, and we have several cell layers, maybe this down here are cuboidal, but as you approach up here, they become columnar. So you will use this columnar to name it. So you use the one in the most superficial layer. So maybe this will be stratified columnar epithelium. So please note that. Okay, let's move on. Look at that maybe in a diagram now. Now, stratified squamous, the deeper layers are usually columnar, but proceeding towards the surface of the epithelium, the cells become increasingly, they become flattened or squamous. So it will be stratified squamous. It may be noted that all cells in this kind of epithelium are not squamous. So the cells at the basal layer might be even say cuboidal, but as you proceed towards the superficial layer, they become squamous. So it will be stratified squamous. Stratified cuboidal, the surface cells are cuboidal in shape. Stratified columnar, the surface cells are columnar in shape. Transitional epithelium, this is a very special epithelium in that it is multi-layered in all all layers are made up of cuboidal, polygonal, or round cells. Then the cells toward the surface of the epithelium are rounded. I like the cells, use this. The cells at the surface, they are umbrella shaped or dome shaped. So you'll find those cells at the surface, they look somewhat like this, dome shaped, like that. Okay, and as you might find, there are some are binucleated. These are the umbrella cells. So you might find some are uninucleated, others are binucleated. So this transitional epithelium is confined to the urinary tract, and for this reason it is called urothelium. Urothelium. So use that. So the cells, the surface cells are umbrella stroke dome shaped. So Let's look at that. Here we are. You can see this column is simple. This column is simple. This is stratified. Then these are the other two. So you can see this is simple squamous. You can see the cells are flattened. These are cuboid. You can see it is somewhat square in shape with a round nucleus. This is columnar. You can see it is oval. The nuclei are oval and they are somewhat rectangular in cross section. Then stratified, you just look at the cells at the surface. So this is stratified squamous, stratified cuboidal, stratified columnar. Then here you can see not all cells like this is not reaching the surface, but all rest on the basement membrane, the basal lamina. So this is pseudostratified columnar. So why columnar? Because the cells which are reaching the superficial layer are the tall ones, the columnar cells. Then you have transition. You see the surface cells are somewhat dome shaped, and you can see like this one is binucleated. So these are the umbrella cells. Let's look at each and every one. Let's start with the simple squamous epithelium. Now you can see this, the one I'm pointed, you can see they are somewhat flattened. In fact, this is the Bowman's capsule. Yeah, so you can see how they look. Okay, then location. They are found in the lung alveoli, mesothelium, endocardium, endothelium, Bowman's capsule. So it is found in the endothelium, endocardium, Bowman's capsule. So endocardium is the inner lining of the heart, endothelium is the inner lining of blood vessels, Bowman's capsule from your high school, you know. Mesothelium refers to the free surface of the peritoneal linings, not of the peritoneum. So it is the free lining of pericardium, pleura, and peritoneum. So those are the body cavities. Pleura is the one which the lungs are contained in the pleura, the heart is contained in the pericardium, and the abdominal viscera is contained in the peritoneum. So the free edges of those body cavities are lined by the mesothelium. Lung alveoli, obviously, you know what is lung alveoli. So let's continue. Simple cuboidal. It usually lines the small excretory ducts and the proximal convoluted tubules of the kidney. So here you can see it is this is a basement membrane here. As you can see, it is one layer. So this is, and you can see the nuclei are rounded. So this is simple cuboidal epithelium. So let's continue. Simple columnar. Simple columnar, they usually it lines the GIT, the gastrointestinal tract, except the esophagus and distal anal canal. So from the gastroesophageal junction, the junction between the stomach and the esophagus, all the way up to the distal anal canal, all that area is lined by the simple columnar. Areas such as the duodenum, the jejunum, the small, the ileum, the colon, those areas are lined by this kind of epithelium. And you can see here, you can see these cells are tall. In fact, this should be, this is ciliated. In fact, this is ciliated, but you can see the nuclei are oval. So yeah, you can see the nuclei there. So this is simple columnar. So let's go to stratified squamous, and this requires some special attention. When you talk about stratified squamous, it has a surface modification in that it is keratinized. It has keratin deposition. So due to this keratinization, it might be classified into three types, namely stratified squamous keratinized, stratified squamous non-keratinized, or stratified squamous parakeratinized epithelium, which is also known as masticatory epithelium. So the stratified squamous parakeratinized epithelium is also known as the masticatory epithelium. Let's look at each and every type. Let's start with stratified squamous keratinized epithelium. It is found in the skin. And you can see here, all this is keratin. In fact, this is from somewhere there up to there. This is the epidermis. If when you run the skin, you run that this keratinized layer is known as the stratum corneum. You will run that. So this is the skin epidermis. So let's look at stratified squamous non-keratinized epithelium. It is usually found in the esophagus, distal anal canal, and in the vagina. I urge you, in every location I state here, you add, let's say, at least one more. So you add one more. You can see here, these surface cells here are flattened, but there is no keratin deposition. So this is non-keratinized epithelium. Then let's look at stratified squamous parakeratinized. Parakeratinized means, yes, there is keratin, but it is not that much. It is also called as, also known as the masticatory, and it is found in the region of the mouth that usually comes into contact with the food, such as the hard palate. So the amount of keratinization is minimal as compared to the amount of keratin on skin. So the amount of keratin in the parakeratinized epithelium is lesser than the one found in stratified squamous keratinized epithelium. So you can see just a small amount of keratin, and it is found in the hard palate. Let's look at stratified cuboidal epithelium. It usually lines the larger excretory ducts of some glands, such as the mucus glands of the esophagus. So excretory ducts. So it will line the excretory ducts of the excretory glands, obviously. So because the glands which are ductful are obviously the exocrine glands. So you can see here we have two cell. This is, as we can conclude that this is stratified. Then you look at the cells at the near the lumen, at the superficial cells. You can see the nuclei are rounded. Use this round nucleus to know that is cuboidal. Then let's look at stratified columnar. It is found in the conjunctiva. Some text I saw them saying in the pharynx, but I'm not sure about that. But here you can see that this is stratified, but you can see the most superficial cells, they have oval-shaped nucleus. So this is stratified columnar, and they are found in the conjunctiva. That is where I'm double sure that you will find stratified columnar epithelium. Then let's look at pseudostratified columnar epithelium. They have their surface modification is presence of cilia or stereocilia, depending on their location. They may contain goblet cells. Okay, they are of three types. If it has cilia and also has goblet cells, it will be known as pseudostratified ciliated columnar epithelium with goblet cells. So you must state all that: pseudostratified ciliated columnar epithelium with goblet cells. We have another one which is known as pseudostratified ciliated columnar without goblet cells. So it is ciliated, but the goblet cells are absent. Then we have the last one, which is known as pseudostratified columnar epithelium with stereocilia. It does not have cilia, it has stereocilia. What is the difference between cilia and stereocilia? Stereocilia, they occur like in bundles, and they are usually long. They are longer than cilia, and they occur in somewhat groups. I will show you that shortly. Let's look at pseudostratified ciliated columnar epithelium with goblet cells. Sorry for not indicating the word epithelium here. It is also known as the respiratory epithelium. It usually lines the airways. That is the nasal cavity, the larynx, the trachea, and the bronchi. So it has goblet cells. So first, you can see as I had said earlier, you can see it is the nuclei at the apical side. The nuclei are devoid on the apical side. Maybe this only one here and this other one, but you can see the nuclei are mostly on the basal side. All these cells are resting on the basement membrane, but not all are reaching the luminous surface. You can see it has a brush border, the cilia. Then you can see these are the goblet cells. This, maybe this. So this is pseudostratified ciliated columnar epithelium with goblet cells, the respiratory epithelium. Then let's look at the other one, the pseudostratified ciliated columnar with epithelium without goblet cells. It is also known as the olfactory epithelium, as it usually lies in the olfactory region. The olfactory region refers to the roof of the nasal cavity. Okay, the roof and the superior 1/3 of the nasal septum and the lateral wall of the nasal cavity. You will look at that. So it is, you can see it is ciliated, but you cannot see here goblet cells. Cannot see goblet cells. So it is pseudostratified, and you can see at the apical surface, it is devoid of nuclei. So that is why it is pseudostratified, ciliated, columnar, without goblet cells. And maybe you are wondering what is that? That is the nerve bundle. Because remember, in the olfactory region, we have the olfactory nerve. That olfactory region is the one responsible for smell. Okay, so let's look at the other one, the last one, the pseudostratified columnar epithelium with stereocilia. It is found in the male reproductive system, in the epididymis and the ductus deferens or the vas deferens. So can see these, they are somewhat occurring in bundles, and they are very, very long. They are not like cilia. And you can see that why I'm saying it is pseudostratified. Can see in the apical surface, they have very few nuclei. In fact, it is like 1, 2, 3. But you can see most nuclei are found in the basal layer. So this is pseudostratified. So let's look at the transitional epithelium, also known as the urothelium. Usually in the urinary tract. Urinary tract refers to the renal pelvis. You have your ureters, the urinary bladder, and part of the urethra. So you can see these cells at here, the surface, you can see they are dome shaped. You can see. And like this one, these are binucleated. These are the umbrella cells. They're binucleated and they are dome shaped. So, but you can see it is stratified. But you look at the cells at the surface, they are dome shaped. That is a transitional epithelium or the urothelium. So, welcome. Thank you for your attention, and please subscribe for more anatomy and biochemistry content. Thank you.